Occupational English Test, Practice Test, Listening Test. This test has 3 parts. In each part you'll hear a number of different extracts. At the start of each extract you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you will have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information you hear. Now, look at the notes for extract 1. This is a Benchmark Education Solutions sample test paper. Extract 1. Questions 1 to 12. You hear a GP talking to a patient about an ongoing problem. For questions 1 to 12, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Hello, Stephanie. How are we today?
Doing okay, I suppose.
Okay, so I see that you made the appointment today because of an ongoing problem. Why don't you tell me more about it?
Yes, I have been feeling a lot of fatigue over the last 6 months or so. At first I brushed it off. I mean, after all, I am an infant school teacher, and most of my colleagues complain of feeling tired at the end of many days.
So, what got you to the point of coming in for an appointment?
I have been spending a lot of my spare time taking classes at my local gym, but recently I've been coming up with reasons not to go to them. After skipping them 3 days in a row, I decided that I needed to do something.
And do you smoke or drink regularly?
I never smoke. How disgusting.
So, a non-smoker. Got it.
I sometimes have a drink, like at a party, but only once a week or so. Also, I don't know if this is important, but I have been mostly vegetarian for the last 5 years. I do often eat fish and also dairy.
So, let's start to get to the bottom of this. Other than the tiredness, have you been experiencing any other symptoms?
Nothing that I can think of. What type of symptom?
Like abdominal pain or a change in appetite?
No, nothing like that. I do sometimes have some issues in the bathroom. Like, I have a bowel movement like 3 times a day, and I don't know if that is normal. Also, sometimes it can be difficult to flush everything down. Is that normal?
Frequent and large bowel movements. That does point to something that could be important. It appears that you're experiencing malabsorption. So what I need to do is order some investigations to find the cause. But let's go back a bit to family history. Do you have any history of abdominal problems in your family?
Yes, I think so. My grandmother, the one who lived in Ireland, died 3 years ago, and I think she had some bowel problems. But to be honest, I don't know the specifics of her death. So with the investigations, what would you actually be looking for?
Well, the first thing would be to see if your white cell count, hemoglobin, platelets and the like are within normal ranges. Anemia, which would be indicated by a low level of hemoglobin, is a common cause of tiredness. But of course, we would then still need to figure out the cause of it.
And what are some of the common causes of malabsorption? What might we be looking at here?
Well, one possibility worth considering is celiac disease, particularly since you mentioned that your Irish grandmother had some bowel problems. Celiac disease is 4 times more common in Ireland than in the rest of the UK, and there is a genetic component to this disease.
And would the results of the investigations be enough to diagnose me with celiac disease?
No, I'm afraid they would not be enough. Depending on the results of the investigations, we would then have to do an endoscopy and biopsy to confirm a diagnosis of celiac disease. Unfortunately, there's no simple blood test we can do.
Are there any other possible diagnoses?
Yes, but I would prefer to wait to talk about other possibilities until we have the results of the investigations. So we can go ahead and take your blood today, and that way we would get the results back by Monday. Are you available for a follow-up appointment on Monday?
I think so, but just let me check my calendar. So let's see.
This is a Benchmark Education Solutions sample test paper. Extract 2, questions 13 to 24. You hear a doctor in a hospital talking with a patient presenting with pneumonia. For questions 13 to 24, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Hello, Mr. Jacobs. I can see on the chart that you were admitted last night with pneumonia, but we know that this is part of a series of health problems, so I'm here to talk about your medical history. Is that okay?
Yes, of course. I'm definitely ready to get to the bottom of all of this. I mean, so many visits to my GP, and then the A&E, and now an actual stay in the hospital.
Yes, I can imagine it has been quite frustrating. So I can see that you told the A&E doctor that you have had a few episodes of cough over the last 6 months.
Yes, and then there's this sudden pain. I think it's happened 3 times. I would be fine, and then there would be this sudden and intense sharp stabbing pain in the right side of my chest. I would try to take a deep breath and it would just get worse. The pain also got worse whenever I coughed or sneezed.
Okay, so right-sided pleuritic chest pain, and so I understand that you went to your GP for this.
Yes, I went to my GP and I did get better after each episode. Another thing I have also gone to my GP for that has not gotten better is my difficulty with swallowing.
Oh, I don't see that here in the notes.
No, I don't think we got to that last night when I came into the A&E. So anyways, I've been having difficulty swallowing for the last 5 years or so.
Oh my, that is quite a long time.
Yes, it is. Starting out, it wasn't a big problem. Food would seem to get stuck right behind the breastbone, but it often got a bit better as I continued to eat. So about 3 years ago, my GP arranged for me to have an outpatient, an upper gastrointestinal endoscopy, which came out normal. That was reassuring, of course, but since then the problem has gotten a lot worse.
What do you mean the problem has gotten more severe? Is there pain?
I have recently started having problems with regurgitation and vomiting. The strange thing is that it appears that the food never even hit my stomach.
And do you have any relevant family history, respiratory issues or digestive issues?
No, not that I'm aware of.
And are you a drinker or smoker?
No, I've never smoked in my life. I do have a few drinks with my friends once a week or so, but no more than 4 or 5 beers a week.
Okay. So I have here the chest x-ray that was taken when you were admitted. So here I can see a dilated, fluid-filled esophagus with no visible gastric air bubble. This explains your respiratory issues.
How so? How is my esophagus related to my lungs?
Well, food is spilling over from your esophagus into your lung, which has caused your episodes of respiratory infections. You said earlier you had them in the right side, and this is consistent with spillover from the esophagus.
But I had that endoscopy done and it didn't show anything at all.
Yes, it seems you had the endoscopy done at the early stage, so that is why it didn't pick anything up.
So what is the diagnosis? Do you have a name for this?
Well, I want to do a few more tests, but the likely diagnosis is achalasia of the cardia, which is a neurological disturbance of the intersecting nerves at the lower end of your esophagus. Other common causes are benign esophageal structures from acid reflux, malignant structures, or an esophageal pouch.
Okay, and what would the treatment for this problem?
That is the end of Part A. Now look at Part B. Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25. You hear part of an announcement in a ward. Now read the question. This is a Benchmark Education Solutions sample test paper.
In light of the spread of the new virus, I wanted to remind all of you about the essentials of the standard precautions to be used in the care of all patients. First of all, hand washing. Staff must always wash hands after touching blood, secretions, excretion, and contaminated items, whether or not gloves are worn. Hand washing must take place immediately after gloves are removed and between patient contact. This is particularly important as the number of infected patients rises. Speaking of gloves, staff must wear gloves when touching blood, body fluids, secretions, excretion, as well as contaminated items. Clean gloves must be put on before touching mucous membranes and non-intact skin. Now, on to protecting during procedures and certain patient care activities that are likely to generate splashed or sprays and blood.
Question 26. You hear part of a training for nurses on medication errors. Now read the question.
Hello everyone, and welcome to this training on managing, reporting and learning from medication errors. First, let's take a look at our main objectives of this course. By the end of the course, you will be able to explain which medication incidents need reporting outside of the organisation, as well as how to set up and monitor a reporting system that ensures that the whole organisation learns from incidents. Next, we will work with case studies so that you will learn how to demonstrate how to carry out root cause investigations of real medicines incidents, how to establish and spread learning from actual incidents, as well as how to differentiate human from systems errors for actual medication incidents. Our final set of objectives is related to
Question 27. You hear 2 nurses discussing a training they took on vaccinations.
So what did you think about the training on vaccinations, the one from last Friday?
I thought it was okay, but perhaps missing a few things. For example, I liked the overview of the legal issues related to vaccination programs because that bit is always changing. I found it quite practical.
Definitely. What about how to identify an appropriate anatomical site for vaccination?
Well, I thought it was quite basic, of course, but we do have quite a variety of experience amongst our nursing staff. So I think it might have been useful for some of the newer nurses who have not given a lot of vaccinations.
I'd not thought of that part before, but now that you mention it.
Question 28. You hear part of a conversation between a trainee doctor and a senior doctor. Now read the question.
I have a few questions about how to interpret this ECG. I can see that the heart rate is about 60 beats per minute, but other than that, I'm not sure if it is normal.
So let's take a look. An ECG recording has various phases of electrical depolarization, which are generally measured in milliseconds. So what is the first interval here?
Oh, that is the PR interval, and the normal range is 120 to 200 milliseconds.
Exactly. And what comes after that?
Then you have the QRS duration, and finally the QT interval, which has a normal range up to 440 milliseconds, though it varies with the heart rate.
So do you see anything out of those normal ranges on this ECG?
Well, no, but there is this.
Question 29. You hear part of a conversation between two dentists. Now read the question.
Have you heard about the new mandatory training package?
Yes, I was just talking with another colleague about it. It seems quite thorough, like it includes legal and safety regulations as well as medical aspects.
Yes, I suppose that is true, but I think it's quite heavy on the legal aspects, don't you?
I don't know. I mean, it does include a lot of content related to legal issues, but that is just part of our reality nowadays. I mean, I know as dentists we don't think of ourselves as having the same risks as some other medical professions, but we can't fall behind in areas like confidentiality and information security, particularly those of us that run their own practices. I mean...
Question 30. You hear a handover between doctors in the A&E. Now read the question.
What a hectic day.
Yes, I can see that. I bet you are ready to get some rest after today. So, what is the problem exactly?
Well, there have been some major problems in handover between ambulances and the emergency department. In theory, they aren't supposed to take over 15 minutes, and then I think the ambulance crews have another 15 minutes to get their vehicle clean and restocked with essentials, but that is not how things have been going today.
I mean, we have ambulance crews waiting over an hour to complete handovers to hospital staff. I mean, some of them must have finished their shift already.
That sounds awful for everyone, most of all the patients.
Exactly. The patients waiting to be admitted into the A&E, as well as the patients out in the community waiting to be conveyed to the hospital.
So why are handovers taking so?
That is the end of Part B. Now look at Part C. Part C. In this part of the test, you'll hear two different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For questions 31 to 42, choose the answer A, B, or C, which fits best according to what you hear. Complete your answers as you listen. Now look at Extract 1. Extract 1. Questions 31 to 36. You hear part of a training for midwives. You now have 90 seconds to read questions 31 to 36. This is a Benchmark Education Solutions sample test paper.
Welcome everyone to this important training on the role of probiotics in pregnancy and breastfeeding and why evidence matters. Before we get started, I want to introduce myself and my co-presenter. My name is Emma Thompson, and I am an accredited practicing functional medicine nutritionist. I'm passionate about education in the area of gut health and microbiome, and so I'm very happy to be with you today to present about this subject. I'm also interested in the role of gut health and the microbiome in fertility, pregnancy, lactation and paediatrics. My co-presenter is Jim Arsenal, who is a registered pharmacist. Jim is passionate about natural and complementary medicine, particularly in how it can assist in restoring the body's natural processes that promote health and prevent disease. This passion, combined with an interest in continuing education, has led him to his speciality in the human microbiome. Speaking of continuing education, it is so great to see you all here today. As we are all aware, the world of healthcare is in constant flux, and as a result, we need to seek out opportunities for continuing professional development, particularly in areas of research and training that were in their infancy or did not exist at all when we were doing our initial medical training. So once again, thank you for your interest in this area. So, the objectives for today's training session include the microbiome, particularly the breast milk microbiome, and why it is crucial in pregnancy and lactation. We will also cover the causes of dysbiosis, what makes a probiotic effective, and why probiotic strain and specificity matters. So, first, we will give an overview of each topic, and then we will have breakout sessions to read and discuss scientific literature. So, let's get started with our first topic, the breast milk microbiome. And as some of you may already be aware of, studies conducted in the last years have demonstrated that human milk represents a continuous supply of beneficial bacteria to the infant gut. These beneficial bacteria contribute to the maturation of the digestive and immune function in the developing infant. While more research still needs to be done to understand how a host of factors, such as medical and environmental, affect the composition of the human milk microbiome, what we do know is that human milk contains multiple biologically active components, including immune factors, lipids, oligosaccharides, microRNAs, hormones, and microorganisms, among others. Some strains of microorganisms that have been found to occur in human milk include the following species: Lactobacillus salivarius, Lactobacillus fermentum, Lactobacillus gasseri, and Bifidobacterium breve, among others. These species have been found to demonstrate the potential to promote mother and infant health, including the prevention of treatment of lactational mastitis. Current areas of research in this area include the roles that milk bacterial communities play on infant health and development, including their influence on the acquisition of the gut microbiota in early life, the roles that they may play on maternal health, as well as their origin, in order to confirm or refuse the existence endogenous oral enteromammary route. During our breakout sessions, we will look at a number of articles on these topics, such as the microbiome in early life, implications for health outcomes between break milk bacterial communities, and establishment and development of the infant gut microbiome. Now, on to dysbiosis. I'm going to start off by addressing mammary dysbiosis or mastitis, which is certainly an unwelcome and debilitating visitor to breastfeeding mothers. A number of factors, such as taking antibiotics in the last trimester of pregnancy, can leave the breast vulnerable to pathologic microbiota. The most common pathogen found in breast milk is Staphylococcus. Fortunately, treatment for this condition has evolved from continued use of antibiotics, which has resulted in some pathogens becoming antibiotic resistant, to include probiotics. Previous studies have demonstrated that a probiotic strain isolated from breast milk to be effective in the treatment of mastitis by reducing pathogen counts in breast milk. So now I'm going to turn it over to my colleague, Jim, to talk about the next topic on our list: what makes a probiotic effective for medical treatment?
Now look at Extract 2. Extract 2. Questions 37 to 42. You hear an interview with a doctor specializing in youth mental health. You now have 90 seconds to read questions 37 to 42.
So, today we have with us a guest who's going to talk on a topic that has all of us concerned: youth mental health. Before I introduce my highly respected guest, I just want to give you some statistics. First of all, 1 in 6 people diagnosed with a mental health condition are between the ages of 10 and 19. In fact, half of all mental health conditions start by age 14. But most cases are undetected and untreated, meaning that the consequences of not addressing mental health conditions extend to adulthood, impairing both physical and mental health, and limited opportunities to lead fulfilling lives as adults. In terms of the types of mental health conditions that many adolescents are diagnosed with, globally, depression is one of the leading causes of illness. This leads me to my final statistic, which is that suicide is the 3rd leading cause of death in 15 to 19-year-olds. I repeat, the 3rd leading cause. So now I am pleased to welcome Dr. Stephen Jackson, a leading expert in adolescent mental health who works with the World Health Organization to design and implement programs related to this topic in countries around the world. Thank you so much for being here today to share with us information on this very important topic.
Thank you very much for the introduction and for making the case that adolescent mental health should be a topic that concerns all of us.
Oh yes, it is definitely a topic that I am passionate about. So can you tell us a bit about mental health determinants in adolescence?
Yes, of course. So anyone who has ever raised a teenager or even been around one knows that adolescence is a unique and challenging time. Multiple physical, emotional, and social changes can make adolescents vulnerable to mental health problems. Factors that contribute to stress during adolescence include a desire for greater autonomy, as well as pressure to conform with peers and the exploration of sexual identity.
I would imagine technology also plays a role.
Yes, access and use of technology play a role. The influence of the media and societal norms can make the difference between a teen's lived reality and their perceptions of the rest of the world hard for them to deal with. They're constantly comparing themselves to others. Other important determinants include home life and relationships with peers. Violence such as harsh parenting and bullying, as well as socio-economic problems, are recognised risks to mental health.
What about teens who are diagnosed early with a mental health condition How does this affect them?
While early detection and treatment is always good, adolescents with mental health conditions are particularly vulnerable to social exclusion, discrimination, stigma, in addition to educational difficulties, risk-taking behaviours, and poor physical health.
So what can be done to support teens during this confusing period in their lives?
This period of life is crucial for developing and maintaining social and emotional habits important for well-being. These include adopting healthy sleep patterns, regular exercise, developing coping, problem-solving, and interpersonal skills, and learning to manage emotions. Emotional disorders commonly emerge during this period, such as depression and anxiety, but also excessive irritability, frustration, and anger. Oftentimes, people ignore these signs because they think they are normal teenage behaviour.
So let's get to a little bit of hope and positivity. In addition to good habits, what can be done to promote and prevent mental health conditions from having a negative effect in the long run on teens' health and futures?
The first course of action is mental health promotion and prevention interventions that aim to strengthen individuals' capacity to regulate emotions, enhance alternatives to risk-taking behaviours, and build resilience into difficult situations. Supportive social environments and networks should also be promoted. These types of programs require a multi-level approach that involves many stakeholders, such as health or social care settings, schools, the community, among others.
So turning from prevention to those teens that have already been diagnosed with the mental health condition, what should be done in those situations?
As I mentioned earlier, early detection and treatment is crucial to address the needs of adolescents with defined mental health conditions. The goal is always to avoid institutionalization and over-medicalization, and prioritizing non-pharmacological approaches. The rights of the child.
That is the end of Part C. You now have 2 minutes to check your answers. That is the end of the listening test.